I was thinking, since I've interviewed a couple of other guests on this topic, if there's precedence in other disciplines of healthcare where perhaps historically all patients in that particular area might have been seen by a medical doctor, maybe a psychiatrist, and now there's plenty of social workers or counselors that are lesser trained, perhaps, or differently trained, that maybe is a better way to put it, but who are seeing the vast majority of those people who need some form of mental health type of intervention, and have the similarly non-complicated type of cases, or maybe dental hygienists seeing patients first and doing a lot of the cleaning and the assessment before an actual dentist might come in. And I don't know if there are other disciplines that would similarly have a parallel to this topic that you're aware of.
Well, I think so. I mean, when we started, it wasn't just physiotherapists who could triage to. We also had counselors and psychologists, and occupational therapists, and the nurses could send to them all directly. And I think you have to see that people who work with one particular kind of problem area get very good at it. And you can see when a patient is not typical. Whereas if you're used to working with a lot of different things, and it's not always as obvious that these symptoms, they're not quite in line with what I'm expecting. And if every patient were to go to the highest level of the caregiver directly, then they'd never get there. There'd be enormously long waiting lists for everyone.
Mm-hmm.
And a lot of patients have that idea that, oh, I have a pain in my back, I have to come to an orthopedic surgeon. But in Sweden, it doesn't work like that. You don't go directly unless you want to do it completely privately and pay a lot for it. But someone is going to be some kind of gatekeeper. Say, is this the kind of condition that should be sent on? And whether it's the doctor sending it to the orthopedic surgeon, or the physiotherapist sending it to the doctor, or the doctor sending it to the physiotherapist, you're still making some kind of judgment which kind of caregiver is most available and who can give the best treatment for this type of problem that you're seeking for, and hopefully to come to the one who's going to give you active treatment directly without taking a long detour and meeting more people than necessary on the way. But everyone cannot go to the orthopedic surgeon who has problems with muscles and joints. And those who do come there unnecessarily are just sent back and go to a physiotherapist. And then they've waited and waited, and finally they get there, and then they get nothing.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.